Nandoon kami sa sa baba ng bahay namin. Tapos biglang nagkaroon ng wave. Nagulat kami. Tapos pumunta kami ng taas. Nung nasa taas na kami, hindi kami mabuksan ng asawa ko dahil ang akala niya ay walang tumakatok. Just a minute. Biglang nawala ang bahay namin dito sa likuran.
On November 8, 2013, a typhoon swept across the Visayas Islands in the Philippines. The typhoon, known as Haiyan or Yolanda locally, affected over 16 million people. 6 months later, the communities affected are slowly recovering. The World Health Organization, or WHO, has worked alongside the government of the Philippines and health organizations to provide immediate and longer-term health care to all those who need it.
WHO's role during an emergency like Typhoon Yolanda is to support the government in coordinating all of the relief efforts to make sure that people have the health needs and supplies and drugs that they require. And then immediately afterwards we were able to get staff on the ground with supplies to begin to help that relief operation. We supported the government in coordinating over 150 foreign medical teams that came with their supplies, their mobile hospitals to help the people of the Philippines.
The typhoon destroyed 582 public health facilities. Priority has been to get these repaired and get equipment and supplies in place to treat all those who need it. The WHO has mapped which health clinics and hospitals most need repairing to help the government focus foreign aid and financial support. In the aftermath of a disaster, a new life is more precious than ever. In the 6 months since the typhoon struck, over 84,000 babies have been born in the areas affected. Now the WHO is working to make sure there are enough facilities for the thousands of children due to be born in the coming months. To prevent the spread of disease, the WHO helped organize a vaccination campaign in the areas affected by the typhoon. Over 108,000 children were immunized for measles and almost 50,000 for polio in typhoon-affected communities. Disease is also spread through dirty water. The typhoon destroyed vital supplies of clean water, both for drinking and washing. The WHO has been working to get clean water to those who need it, making sure there's regular inspection of water supplies to measure how clean the water really is, and teaching communities to make sure their water is clean. In the aftermath of an emergency, many people have a hard time adjusting. Some are bereaved, some newly disabled. Some have worked hard to help others and now are overcome themselves.
I am Gloria Caborne, senior nurse at the Alvin Memorial Hospital in Balangig, Eastern Samar, which was devastated by the Typhoon Yolanda. I am thankful that many NGOs are coming here because on that day I came here in the hospital at 8 o'clock and many patients are coming, injured patients with different kinds of wounds, and we have a limited stock, like for example for the anesthesia.
The WHO has been training local health workers in psychological first aid. This gives immediate support to those most affected. People are encouraged to listen to one another, to look out for signs of distress, and if needed, link people to the mental health services they needed. For children, it can be as simple as finding them a space to play.
The real hard work of rebuilding the health system has begun. WHO is supporting the government on the rebuild of some health facilities, on coordinating international efforts to get those hospitals and health clinics back up and running, but also making sure that where there are gaps in services, for example maternity services or newborn child services, mental health, that we're able to help support filling those gaps as well, so that the affected population really can get back on its feet as quickly as possible and we have a robust and resilient health system moving forward.
Thank you.